Come in.
Hi, my name is Sierra Kavanaugh. I'm a Regis College student nurse, and I'm going to be performing your cardiovascular and your peripheral vascular assessment today. I'm going to be inspecting your skin, palpating your veins and arteries, and osculating your heart sounds if that's okay.
Yes.
Okay, now before we start, I'm just going to need your consent for videotaping. Okay, and I'll check your hospital wristband. Okay, and if you could verify your name and date of birth.
Brandon Parents, March 4th, 2002.
Okay, so now before we start, are you experiencing any chest pain, heart palpitations, shortness of breath, or dizziness? Okay, so now I'm going to position you in the recumbent position at a 30-degree angle. Okay, now I'm going to inspect your precordium, and I'm going to assess your skin integrity, breakdown, and lesions. So your skin is intact, there's no breakdowns or lesions. So now I'm going to be assessing your skin color for cyanosis, pallor, pulsations, and heaves. And your skin color matches your ethnicity, and there are no pulsations or heaves. Now I'm going to be palpating your precordium for tenderness, pulsations, and thrills. Okay, and there's no tenderness, pulsations, or thrills. Now I'm going to locate your point of maximal impulse, which is your apical pulse, and it's located on your fifth intercostal on the midclavicular line. Okay. Now I'm going to check the right side of your neck for a jugular venous distension. There is a no jugular venous distension on the right side of your neck. And there's no jugular venous distension on the left side of your neck. Now I'm going to palpate your carotid arteries, and I'm going to grade them based on their pulse. Okay, so your carotid arteries are a +2 bilaterally. Now I'm going to osculate your carotid arteries, and I'm going to ask you to hold your breath so I could listen for bruits. And I'm going to be using this with the bell of my stethoscope. And you are negative for bruits bilaterally. Now I'm going to osculate all 5 heart sounds using the diaphragm of my stethoscope. I'm going to start off with your aorta, then moving to your pulmonary valve, then Erb's point, then the tricuspid valve, and now I'm going to listen to your mitral valve for 1 minute. Okay? Your pulse rate is expected and your heart rate is 90. Now I'm going to be listening for heart murmurs in all 5 spots again. And I'm going to be using this with the bell of my stethoscope. starting off with your aortic valve, then your pulmonary valve, then Erb's point, then your tricuspid valve, and then your mitral valve. And there are no murmurs present. Your cardiovascular assessment is complete. Okay, and before we get started with your peripheral vascular assessment today, are you experiencing any edema, swelling, numbness, or tingling?
No.
Perfect. So now I'm going to inspect your upper extremity by assessing your skin integrity, skin breakdown, and lesions. Okay, and your skin integrity looks great. You have no skin breakdowns or lesions. Now I'm going to assess your capillary refill on your nail beds of your fingers. Okay, and your capillary refill is below 2 seconds on your fingers. Now I'm going to locate your brachial artery and grade it based on its pulse. Your brachial pulse is a +2 bilaterally. I'm going to locate your radial pulse. Your radial pulse is a +2 bilaterally, and I'm going to locate your ulnar pulse. And your ulnar pulse is also a +2 bilaterally. Now I'm going to inspect your lower extremity for your skin integrity, skin breakdown, and lesions. Okay, so your skin integrity looks great. You have no skin breakdowns or lesions. Now I'm going to assess your ankles for edemas. And no edemas are found on your ankles. Okay, now I'm going to palpate your lower extremity with the dorsal aspect of my hand. Okay, and your temperature is warm and you're moisturized. Now I'm going to defer your femoral pulse, and I'm going to start off with your popliteal pulse. Okay, your popliteal pulse is a +2 bilaterally. And now I'm going to locate your tibialis pulse. Okay, your tibialis pulse is a +2 bilaterally, and now I'm going to locate your dorsalis pulse. Your dorsalis pulse is also a +2 bilaterally, and lastly, now I'm going to assess your capillary refill of your toes. Great, your capillary refill on your toes is less than 2 seconds. And now your peripheral vascular assessment is complete.